Hello, thanks for joining us. I'm Dr. Decker, this is Dr. Hartman. We're both part of the Physical Medicine and Rehab Division of the Department of Orthopedics. So mostly we work with non-operative orthopedics, non-operative sports medicine. And we're also in the division of the Orthopedic Injury Clinic, which is a walk-in clinic in the afternoons where you don't need to make an appointment and we'll evaluate orthopedic conditions. So today we have the task of talking about low back pain. Dr. Hartman, you want to say anything else about?
No, I think you did a great job of summarizing kind of our roles and how we help provide care to people. So we see a lot of patients through our orthopedic injury clinic and also through our primary physiatric clinics. And I think this is a great opportunity to talk a little bit about back pain and how to keep people active and moving, either in spite of or to get around the back pain that they have.
And there's quite a bit of things that you can do at home to stay away from the doctors if you so wish. So we'll talk a little bit about kind of the most common causes of back pain. Back pain is definitely one of the most common reasons that anyone sees the doctor. There's several different reasons for this. Some of the most common are just ligament sprains and muscle sprains, which you can get from, kind of doing yard work and that sort of thing. Also, there's the risk of a bulging disc or a herniated disc. And then there's also arthritis in the back of the spine. And so the problem with this is all these sort of conditions present similarly. So it's low back pain and it's somewhat hard to differentiate them. An easier way of doing that for us is kind of, we can base it by age group. So usually the younger type of patients are going to have more issues with discogenic pain, and the older patients will have more arthritis, but those are not hard, fast rules. I mean, there can be some mix between the two of them. I don't know if Dr. Hartman wants to kind of go over the spine model here to talk.
Absolutely. So a lot of people come in and they ask, they're like, oh, I have back pain and it recently started, and they think that they've have a sciatic nerve injury, or they think that they have a disc injury, or they have some arthritis. So it's helpful to kind of go over it with a model, what exactly we have going on here. So this is just part of the spine. So these are the vertebrae here. These little clear guys here are the discs. And on this model, it's got a little angry red guy. So this is a disc that's decided to kind of bulge focally. So like a disc protrusion. So discs usually will bulge kind of out to the side, or they'll bulge straight back. And that can really be one reason that people get significant back pain. And usually that's not just because of the disc, but you can see this little guy, the yellow piece right there, that's a nerve. And those nerves like to get irritated as well. If we turn our attention to these little interlocking joints right here, these are facet joints, and these are some common areas that like to get arthritis as well. And so in our aging population, especially in people who have pain with like bending backwards, they can have, that can be due to some symptomatic facet arthritis. And then back through here, you have a lot of ligaments and muscles that will end up attaching kind of onto the bones back in the spine to provide stability and allow you to bend forward or bend backwards. And you can certainly strain the muscles attached to the spine. And so all of these can be things that kind of contribute to common causes of back pain. Dr. Decker, do you have anything to add?
Yeah, absolutely. Just briefly going over the spine here. So there's 5 lumbar vertebral bodies, and those are the bones of the spine. And then in between each one of the bones is the disc, which is the soft spacer essentially. So the outside of the disc has sort of a rigid membrane to it, and the inside is more of jelly-like material. So discs can bulge backwards, or they can herniate, meaning some of that material on the inside of the disc has started to come outwards. And then those joints on the back are called the facet joints, like Dr. Hartman talked about, and those are responsible for basically the stability of the spine towards the back, and they're maximally loaded when you lean backwards. So this is sort of a way of how we tell, what seems to be the etiology of someone's pain. If pain is usually worse with prolonged standing and doing activities sort of in front of you, as well as leaning backwards and loading the spine, then we're thinking maybe this is more arthritis in the back of the spine. Versus in an acute disc herniation, most of those patients would not want to be sitting down, Leaning forward, picking up things are going to be sort of the worst in terms of loading the disc. Additionally, sitting for a prolonged period of time, like a long extended car trip and that sort of thing, is more kind of a discogenic issue. And then the muscle sprains or strains seem to be more superficial, and you can kind of feel in the muscles, you get tightness and spasms. And so those sort of resolve spontaneously on their own by doing some things at home. So it isn't necessarily a reason that you need to come in and see the doctor. But some of the reasons that we would definitely want you to come in is if pain is like extremely severe, you can't really do anything functionally. I mean, I think that's at least worth coming in to get evaluated. Another reason that this is from a fall. So kind of the older population, if you fall, when the bone density is a little bit lower, we always worry about compression fractures. So that's something that's at least worthwhile coming in and seeing us. And we are primarily talking about low back pain, but we know that oftentimes low back pain presents with leg pain as well. So if you have any weakness or numbness in the legs, we definitely want to see you and evaluate you. And if you have any changes in your bowel or bladder function, again, that's something we want to know about right away.
Absolutely, absolutely. So totally second what Dr. Decker had to say there. Kind of segueing from when to come to see us would be some things that make us more concerned that you might end up developing back pain. So there are several different risk factors for people who end up getting back pain. So some of them are like common things such as smoking. We know that smokers are at a higher risk for developing back pain, but some of them are like just being sedentary and issues with your posture. So in people who do a lot of sitting, some of the muscles that support the spine can end up getting tight, or some of the muscles that support the spine can end up not being used, in particular like your hip muscles and your core muscles. And so doing more standing and walking can help to engage some of those muscles. There are also some somewhat preventative exercises that you can incorporate to help make sure those muscles stay engaged. So some exercises that I like are things like planks, side planks, glute bridges. An exercise called a bird dog, where if we had some more room, we could have Dr. Decker show us how to do that. But basically you lay on your back and put one arm over your head and have your knees bent up. And so all of these exercises can be ones that help to engage the muscles that support your spine to allow you to be more mobile and have less back pain and be more functional. And then another risk factor for the development of back pain can be age. So we know, like Dr. Decker mentioned, with advancing age, you can have more arthritic changes. Your bone density or how strong your bones are can go down, which can lead you to have compression fractures, which are things that are concerned. So all of those things can kind of tie into making it more likely that you develop some back pain. Dr. Decker, do you have anything to add?
Yeah, so back to the exercises, I think one of the main points is that, even if you're not having back pain, these are exercises you need to be doing regularly. So for one, so one of my days I'm in the injection suite and I'm wearing a heavy lead vest to protect myself from the x-ray. And I know at the end of the days, I'm having some discogenic low back pain. And so I have some exercises that I do at home so I can get through the day and not be uncomfortable. Bird dogs are one of my favorites. I know Dr. Hartman kind of described this already, but you're basically in the quadruped position on the ground and you're raising the opposite arm, the opposite leg, and that strengthens the whole myofascial area there in the back and stabilizes your spine. So that's a very, very important one to do, as well as keeping your core strong. So abdominal muscle strengthening, whether that's crunches or side planks or planks, those are all super important to do. And then posture. So, I have a huge problem with my posture. As you can see, I'm kind of slumped forward, rolling the shoulders forward, and this is actually the worst position for your disc. So at some point, I'm going to have a big problem with my disc. But it's about sitting up straight, putting the appropriate load on the spine. And it's the same thing with standing. A lot of us like to kind of slouch when we stand because it's easier. Because when you slouch, you're riding right on your spine and you're not activating that musculature, which is really protecting your spine in the long run. So those are two of the most common things that we need to get better at. And the other issue is that, COVID has kind of changed our lifestyle. So a lot of us are doing things differently now. So we have more time at home, picking up gardening, home improvement projects, not getting to the gym as often. picking up new kind of exercise routines. So all of that, changing the routine, is a huge risk factor for getting back pain. And we've seen a lot more through our injury clinic because of this. So I think incorporating some of these exercises in your routine will help prevent you from having acute flares of back pain. Yeah, and then go ahead.
I was going to say, we got a question from the audience about some numbness on the outside of the thighs that's present with standing or walking. And so that certainly could be a presentation for someone who's got some back-mediated symptoms. Numbness can sometimes be coming from the back in and of itself. So you don't necessarily have to have back pain for a nerve issue to be coming from your back. A lot of the time, though, there are other conditions that can lead to outside of the thigh numbness. So one of those, you have a sensory nerve that kind of sits on the outside of the thigh that can get compressed, and that can lead to numbness along the outside of the thigh. So that certainly can be something worth looking into.
Yeah, so I think in that sort of case, I think it's worthwhile seeing us. Anytime you have numbness or weakness, it means the nerve is being irritated and damaged. And so that's worth seeing us. We certainly don't want any further damage. We're talking about, so, the main things that we think that maybe you could be able to treat these on your own are like axial low back pain, to pain just localizes in the back. And typically, if this is muscular related, it's going to start feeling better in a week or so. And if it's not getting better, then it maybe makes sense to see us and see if there's something else going on.
Absolutely.
And another question here. So being older, I have back problems, but the worst is when I get up from sitting. Back pain changes into my groin and makes it difficult to move my legs. Any suggestions on how to help with that? So yeah, so classically with arthritis, when you're sitting, the joints start to get a little bit stiffer. When you first get up, it's really uncomfortable. And as you start to move around, those joints start to loosen up. So all the joints have a fibrous capsule around them and fluid within the joint. So a knee is a good example of that. It's just a very large joint. And so people with arthritis, it's usually the most uncomfortable when you first get up and going, and it's because the capsule's stiffening, the fluid in there is maybe getting a little bit thicker, and it's hard to move around. When pain starts to radiate in the legs, it doesn't necessarily mean that it's coming from a nerve in your back going down the legs. There are referral patterns, meaning that pain, the source of the pain is the facet joint, or the joint in the back of the spine, can actually refer pain all the way down to the ankle. So that's not uncommon. Usually when there's a nerve issue, you're going to have a different type of pain. It's like a burning, tingling pain, or weakness, or numbness, that sort of thing. So what to help with that, I'd say start doing some of these exercises, working on stabilizing your spine and making those muscles stronger so that there's less force going onto the joints themselves. Activity in general is good. So I don't want you sitting for, hours and hours at a time. If you're able to get up and move, then it's going to make that stiffness a little bit better every single time you get up.
Yeah, absolutely. To kind of build upon what Dr. Decker was saying, though, it can be really helpful to have the right diagnosis for how to move forward. A lot of the times, pain that's in your back and then radiates to your groin, that can sometimes that can come from your hip itself. And so making sure you have the right thing to focus on can be very important. I've grabbed this lovely spine model again to kind of highlight how, so this makes up the acetabulum of the hip. And I just was pulling this up to highlight that how closely interrelated the hip is to the actual low back. And so problems that are going on with one can oftentimes affect the other. And so these can become problematic when they start to irritate each other because your hip's not moving well and then your spine's not moving well and vice versa.
Yeah, absolutely. Thanks for catching that. Yeah, and the other joint kind of in the low back, posterior pelvis, is called the sacroiliac joint. And so that's the joint between the very bottom portion of the spine and then the hips. And so between the lumbar facet joints, the sacroiliac joint, and the hip, that transmits all the force from the lower extremities to the spine and from the spine to the lower extremities. So there is a whole lot of motion and force that go through those joints. And if any one of them is not functioning correctly, it forces the other two to work harder, advance arthritis, cause more pain. So it's definitely, worthwhile to kind of look into all these sources. And you're absolutely right. Getting the correct diagnosis is really important because some of the exercises for the back may necessarily help with the hip and vice versa.
Absolutely. All right. So We've talked a little bit about prevention. We talked a little bit about exercises that can prevent back pain. We talked a little bit about posture and how Dr. Decker really loves his forward flexed, rolled shoulder posture. He didn't talk about how he likes to have his pelvis tilted forward either, but we'll spare him on that one. But there's also a role to, like what you eat can play a role in helping you to prevent some back pain. And so beyond even concerns about weight, your diet can provide increased inflammation. And so being conscientious of what you're eating and eating real foods, not just following any specific diet, but trying to cut out processed foods can certainly be something that helps to prevent back pain.
Are you changing your diet at all to help with inflammation?
You know, that's a great question. Over the years, I've made some evolution to my diet. So I've adapted a more plant-centric diet. I eat a lot of like whole foods that are plants on a very regular basis. And I think overall that's really helped some of my old man joint-related pains, because I clearly look very old.
So we'll have a couple of case studies here. So Dr. Hartman has a anti-inflammatory diet. He really works on his strength and his posture. And I, on the other hand, are a meat-heavy diet and slouch. So we'll see who has back pain first. So I challenge you to be more like Dr. Hartman, because I think that I'm going to run into some trouble pretty soon.
Okay. It looks like we have another question from the group. Question is, I have a right hip labrum tear with pain constantly in my groin and buttocks. What's my next step? So kind of next steps for referred pain from your labrum kind of depend on what you've already tried. So some things that can be helpful for labrum-based pain would be physical therapy to optimize how your hip's working, and then making sure your pain's coming from inside your hip joint. So again, making sure that we have the right diagnosis for your pain generator is certainly something that's helpful, but those would kind of be the next steps that I would think of.
Yeah, conservative care, I mean, so physical therapy is essential for this. Can consider diagnostic injections, so just putting local anesthetic into the hip joint and to make sure that all the pain is truly coming from the labral tear itself and not referred source from somewhere else. Would be really important. So again, making sure we have a clear diagnosis before we go on for treatment of that.
Absolutely.
So I guess, so say your back pain's continued for a couple of weeks and, this home exercise program hasn't really helped you. Dr. Hartman, can you talk us through kind of what would happen if you came to the clinic or you came in through the injury clinic, how we would assess your back pain?
Absolutely. So through the injury clinic, we like to do a detailed history and exam. So we start by just kind of talking to you and seeing kind of what triggered your back pain and what things make your back pain hurt more or less. Those are really helpful in helping us to figure out what components of your back are really driving a lot of your pain. And then we do a pretty detailed physical exam. We watch you walk. We'll have you bend forward and bend backwards and twist. And then check your strength and sensation to make sure that there isn't evidence of nerve damage. The utility of having you move around is that it can help us know which parts of your spine, when we put force through them, are irritated. So if you have back pain, or if you come in, you've got acute back pain, it's been going on for a couple of weeks, it's not getting any better. It hurts when you sneeze and when you sit. And then we examine you and you bend forward and you're like, nope, this is not it. This is really terrible. That gives me information that this is probably coming from your disc. Whereas if you've had back pain and it hurts pretty bad when you're standing, and then when you tried to reach overhead, and then we examine you and you've got tenderness kind of along your spine, and when you bend backwards and rotate, you get a lot more back pain. That would give me an indication that this is possibly coming from a facet joint. And then if you just kind of have focal tenderness when we push on your back, that can be more of an indicator that this is more of a muscle strain and it's just taking a long time to get better. There are certainly other reasons that people can have back pain, and those are things that we usually will figure out from the history and the exam. Also, when we have patients come in from an orthopedic standpoint, we like to get x-rays to really check the alignment of the spine, to make sure that you don't have, like if you had a fall and you're a little bit older, you don't have things like a compression fracture or the alignment has changed. Dr. Decker, do you want to talk a little bit more about the alignment of the spine on x-rays?
Yeah, absolutely. So usually we check both flexion and extension views. So that's, leaning forward and leaning back. And we can do x-rays to make sure those vertebral bodies or the bones of the spine don't slip over one another. So we want them to maintain their alignment, because when they start slipping, they start irritating those facet joints in the back and can potentially get some arthritis pretty quickly and narrow the nerve roots. So that's an important part of our initial exam. And then, this comes up all the time, is ordering MRIs for back pain. And so the real issue is that, at least with initial management of back pain, an MRI is really not going to change our management. So oftentimes there's just really no sense in doing this for, several weeks unless this really persists. Because most of the time it's not going to be a surgical operation. We're not going to be doing injections off the bat. So we really want to see, how you can improve with changing your muscle strength and doing physical therapy and that sort of thing. However, if you do have weakness in your leg, you have sensory deficits, that is something that we want to see a little bit better, and we can talk about injections sooner. But for the classic presentation of low back pain off the bat, we're really not going to order any MRIs. I don't know if you had anything else for that.
Absolutely. Sounds like there's a party going on outside. So other things that we will kind of use to help with back pain. So we've mentioned it a couple of times. Physical therapy is kind of our staple treatment for back pain. It really helps to get people moving better and get you back to being in control of what your body is doing, and allow you to be more active without having to come see people like myself and Dr. Decker. But some other things that we'll use are different medications. So some common medications that we'll use for acute, really angry back pain will be things like prednisone, which is a really potent anti-inflammatory medication. We usually give it for a short period of time to try to decrease your inflammation as much as we can. And then follow that with possibly another anti-inflammatory or different medication. Sometimes for people that have really tight, angry muscles, we can give a muscle relaxer. One that we commonly will use is something like Flexeril or something along those lines. We oftentimes will give those medications to take advantage of some of their side effects, where they can make you feel a little bit sleepy. And then sometimes we'll give medicines if you got back pain and leg pain, to help the nerve to be less irritable. So these are nerve stabilizing medications like a gabapentin or a Lyrica, which on a short-term basis can be helpful. Dr. Decker, do you want to talk about any of the other treatments that we have available to us for people with?
Yeah, so other options, if this is specifically muscle related or a ligamentous, strain sort of in the back, we can consider doing trigger point injections, and that's using, one of our smallest gauge needles and going into these muscles, injecting a small amount of numbing medication and needling around to help relax the muscle. So that's one option that we can do in clinic when we initially see you. Another option is bracing. So although I don't recommend bracing to prevent low back pain, the studies show that doesn't really help all that much. Bracing, once you have back pain, especially if there's a directional component to it, so if pain is worse when you're leaning forward or leaning back, bracing you so that you're limiting that sort of motion can really help eliminate that pain flare or tamper that pain flare. I certainly wouldn't want you wearing a brace for months and months on end, but for an acute flare of back pain, I think it absolutely is indicated.
Absolutely. So also, I think it's important from a bracing standpoint that it can help you to re-educate some of the muscles to be active. So a lot of those core stabilizing muscles that get turned off when you have acute back pain, the brace not only helps to support, but can help you to kind of have a proprioceptive or a feeling to trigger those to be back on. So bracing can help from multiple different ways.
Absolutely.
Absolutely. All right. So I think we've covered a lot of the topics that we set out to cover kind of initially. Dr. Decker, do you have any closing words that you'd like to add?
No, I think that's it. You know, we're happy to see you if this back pain is something that's severe or has lasted for a couple weeks and you really need to see us. You can either make an appointment to see us in our regular clinics through physical medicine and rehab by calling the orthopedics department, or if this is more of an urgent matter and want to be seen right away, or you have an acute injury, our orthopedic injury clinic is open from 12 to 6 every weekday, and then from 8 to 12 a.m. on Saturday mornings. And so our 2 locations are one down in South County, and the other one is in Chesterfield off of 64. And so, you know, previously those were walk-in clinics. Now, because of the coronavirus restrictions, we're having you call ahead, but it still doesn't require an appointment necessarily. I don't know if you have anything else to add for that.
No, I think that those are the highlights to how to get in to be seen by, in clinic. So if you have acute back pain, we are more than happy to see you. If you've had chronic back pain as well, we're happy to see you as well and kind of take a look at you and see how things are going. But hopefully you guys have found this to be helpful information and can use some of the stuff that we talked about to help you get back to life.
All right. Thanks for joining us, everyone. Have a great day.
All right.